Well, good morning. I think we are going to verge on breaking a little silence today, talking about something that the silence needs to be broken, should have been broken, and we're going to break the silence on menopause, I think. So we're going to dive deep into why there's silence, about the silence of menopause, and go from there.
You're listening to the Cheeky Clinic podcast. I'm Dr. Chris Delp.
And I'm Kat Parker-Delp, owner of Duluth Med Spa.
If you've arrived at a point in life where good enough is simply just not good enough for you, you're in the right place.
Here we cover topics like sexual health and wellness, hormonal balance, and body optimization. And we deliver to you lessons from our travels from hard-to-get-to places around the world.
We are so excited you're here to venture off the beaten path with us into the taboo where no subject is off limits.
Welcome to the Cheeky Clinic. Let's dive in. So there is, before we dig too much into menopause, I want to say that there is an amazing film that is coming out. It is called the M Factor film. It will be aired on PBS this month, and we have the privilege of airing that ourselves through our clinic. It will be aired on November 13th at the Zeitgeist Cinema. So we hope to see our local listeners there, but just breaking the silence on menopause and all of the generations and generations of all the women before us that have gone to their provider, had all of these issues, and nobody has listened to them. And a lot of this film will relate on the fact that this is not the fault of the provider. And the women that go there go to their provider wanting to talk about, the night sweats, the brain fog, the lack of libido, and we just get told that, it's menopause. You'll get through it. And so this film is really going to break the silence on the fact that this is not just menopause, but more so on the fact that this is not about a bad provider. It's lack of education in the current providers that we have. It's the million physicians that are out there, feet on the ground, that were never educated on menopause and through no fault of their own. It was just not something that was looked at. Female health was not a big topic of conversation for the many generations before us. But it has become a topic of conversation now. And there are a group of women that are fighting for physicians to be aware of this. And of note, this documentary is the very first, I believe, the very first documentary that has come out that I believe the American Board of Physicians or the different groups will now count towards. Any physician or provider that watches this can get CMEs for it, because they just want to give awareness to the current providers that are out there that menopause is a huge problem. There are ways to treat it. Listen to your clients or listen to your patients. And there are ways that we do not have to suffer as women for a lot of things that happen in menopause. So I just want to put that out there. November 13th, we'll be showing the M Factor film at the Cinema, and tickets will be available shortly. So I'll let you take it from here, because you are a physician, and I don't know what you ever learned about menopause in medical school, but I think a lot of physicians were not aware of the treatments and the problems.
And when was it going to be airing on PBS for the rest of the listeners?
It will air on PBS October 17th, which will be before I believe this airs. But after the original airing on the 17th, then it is by different local practices that have the rights to air it, which we are one of.
So everybody watch this. Watch this film. So it's easy to talk about what I learned in medical school about menopause. It's something you just go through, and that's it. You just go through. Now, contrast that with erectile dysfunction. my God, no, you're not going to go through that. We're going to do all sorts of stuff. And there's so much, there's technology that we would use for that. There's medications that we would use for that. So the contrast is really spectacular between menopause and erectile dysfunction. Menopause is just something you have to deal with. Erectile dysfunction is not anything we will ever deal with. So from kind of a perspective when we're talking about female hormone replacement and menopause, you know, we're going to die. We're all going to die. Like the Onion headline said, despite doctors' best efforts, the death rate still hovers around 100%. So what we're trying to do, as one famous lady that I know said, it's not how much time is left in your life, but how much life is left in your time. I'm quoting Kat. So one of the many tools that we've got is hormone replacement. And today we're just going to focus just on women. There's been we'll come back to men at a later time. There's plenty of data on men, but we're going to talk just about some of the roles that women's hormones have, and what happens when those hormones shut down. And when I said, we're all going to die, we all go through an aging process, and that aging process inevitably ends up with changes. One of the big ones is hormones. We're designed to have kids. Our hormone levels decrease, and that can contribute to aging.
I feel like, though, too, you think about women as young girls. We are taught or listened to. Some of us are not taught, but we hear. I mean, I don't recall ever getting to sit down and talk about my hormones as a young girl, or the period talk. I really don't recall ever getting the period talk from my parents. But I think I just kind of learned it from, this is going to happen. It was the scuttlebutt around, But I think that we celebrate all these parts of women's lives, like, oh, you got your first period, and then we have baby announcements, and it's they're having a baby, and there's all these different parts of a woman's life, and then we get to menopause, and nobody wants to talk about it. You get to menopause, and it is this horrible, horrible thing, and it does not have to be. And I think that is so important for women to understand, that menopause does not have to be horrible. It is part of our life. It is just the next step in our aging process, but it doesn't have to be horrible.
So when you don't talk about menopause, I have to say, I never heard the end of it.
It was horrible for me until I realized that there was help. I mean, a little backstory here, a little personal backstory here. So when I started going through menopause, it was really life-changing, horrible for me. Of all the different times in my life as a female, stages in life, menopause hit me like, holy crap, what is going on? Huge, the sweats, all of the things. It hit me hard, so hard that I was at our place in Florida and decided on my own that I needed to go find out what was going on with my body, and was going to get all these, labs drawn and what's happening, because I thought I was going absolutely nuts. But the bottom line is, it was simply just hormones, and I needed hormone replacement because my body had had estrogen forever and ever and ever, and now all of a sudden my brain doesn't have it. So when your brain doesn't have it, then it changes everything, So I think there's so much to talk about in the fact that it doesn't have to be something that we don't address as women, and we need to be able to have the education that there is help, there is the ability to not have a miserable menopausal life.
So that brings up the definition of normal. When you go and get your labs drawn, your labs were normal. for a postmenopausal woman.
Exactly.
So if the lab says that you're normal, then you're normal, and whatever you're feeling is just on you. And that's where a lot of women will feel very different postmenopausal. So
But their
they go.
doctor's telling them that they're normal.
So they go to their doctor and they draw those labs and they're normal. So they say, well, you're depressed. So here's an antidepressant. And now you're gaining weight because you're on an antidepressant. Well, then this is what you need to do. And then you start feeling anxious. So you get anti-anxiety agents. And each symptom, and in defense of a physician, when you come to us with a symptom, our training is to help you with that symptom. And if you are anxious, then I'm going to try to help you with your anxiety. If you're feeling, depressed, if you're feeling all those things, then I will take that, run tests. If the tests say that that's normal, then I'm going to treat your symptom.
And that's how physicians have been trained until now. I believe that's what, in my opinion, I'm not a physician, but I feel like there's so many out there that just go on a lab value, and it's not all about a lab value. That lab value, like you said, is correct for a menopausal woman, but it's not correct in my body. It was not correct for me, somebody who had a extremely high sex drive, and all of a sudden I'm depleted in hormones, and I don't have to be depleted. You can change that. So one person's normal may not be another person's normal, but to providers out there, I think that their training is to go on a lab value, and what's normal is what they were trained to. And why is that?
Well, we are how we're trained. And if you take kind of this natural approach, then this is what happens to your body. So you're just going to have to adapt with it. Now, granted, if you look what our bodies have been doing, they're living longer and longer and longer. So it goes back again to, how do you want to live that length of your life? Do you still want to have a sex drive?
Absolutely.
And it's funny, we heard a story about a divorce lawyer who said the worst thing in his practice is when somebody starts doing bioidentical hormone replacement, because now one of the problems is women's sex drive goes back to where they were in the 30s.
Absolutely.
And everybody gets...
Give me all the hormones back.
So let's... I want to just delve into a few of the roles that hormones have and what happens during menopause. So menopause is the period of time where your body stops making estrogen. And so what does that do? What does estrogen do? And we know that in a premenopausal person, how it helps regulate your menstrual cycle. But when it completely drops down to zero, that's where a lot of your effects that you're feeling. So what exactly does estrogen do from a beneficial standpoint? It impacts your bone. It helps with bone growth. Now, we all know that women get osteoporosis, and they don't get that when they're in their 30s.
Because they've got estrogen.
Yeah, because they've got estrogen. So one of the things that they look at is technically the osteoclasts and osteoblasts. Their activity is influenced by estrogen. And so one of the major risk factors for death for women is breaking your hip, falling and breaking your hip. So one of the functions is to maintain bone health. The other is cardiovascular health. We all know that women are better at men in terms of cardiovascular health. They die later from cardiovascular disease. And one of the reasons is the protective effect of estrogen. But there's a lot of other things that you alluded to, is mood. That estrogen definitely has a role in your brain, both in mood, cognitive abilities, that brain fog that a lot of women talk about in menopause.
And skin. Can we talk about skin? I
Well,
mean,
your
hello.
favorite your favorite subject. Go ahead and talk about skin.
I mean, it's just so helpful in your skin, and it all of that goes away. You've got dry, then you're looking dry, and you feel all of a sudden overnight. There's a point in menopause where I feel, for me, that was like, holy crap, I look old, or I look like my skin is different, and it's estrogen. You need the estrogen. It does a lot of good.
So when you're talking about what it does, and the function, one of the functions of estrogen is collagen production, and there's actually a physiological switch as your estrogen levels drop. You make a different type of collagen. It stimulates a different pathway. Estrogen will definitely stimulate a completely different pathway of collagen production, which is one of the reasons why the pelvic floor of the women, the vaginal tissue and the whole pelvic floor is really, with estrogen, you're making a different type of connective tissue and a collagen there. So that's where we get problems when you withdraw that estrogen with atrophy, and that entire pelvic floor develops atrophy during
So
this.
I hate to interrupt you here, but I have to tell a little story, and I'm going to leave names out of it. But I have a friend that, speaking of vaginal atrophy,
Your poor friend.
I'm going to leave names out of it, but let's just say I have a friend, and she had opened up her health online portal health while she was at our house, and was reading through her portal, and had got a results back of her pelvic exam, and it said atrophy. And we got the biggest kick out of we were just like, we found it very, very funny that they would label her vagina as atrophy. And, but all kidding aside, these are things that her provider could have done vaginal creams, estrogen creams, to prevent some of that atrophy. And there's so much that just different types of estrogen roles that different types of estrogen can play in women's health. So for skin, for your brain, for all of the things, but there's creams and vaginal creams and estrogen that could also benefit that.
The same unknown person fixed us dinner, and she way overcooked chicken breasts. And I recall you taking the chicken breast and saying, "Boy, this is just like your pelvic exam, dry and atrophied."
Oh, God bless her. She's going to kill me, but that's all right.
As long as you're not naming
I'm
names
not
or what it
naming names.
reminds us.
But
So,
yeah, the estrogen plays so many roles, so many roles.
So when we talk about hormone replacement, that's one of the many different ways to do hormone replacement. I think just rounding out the other hormones that are at play here, progesterone is another essential hormone. Again, regulating the pregnancy and regulating your menstrual cycle. In a post-menopausal woman, progesterone also has roles. A big one is sleep. One of the problems that a lot of people complain about postmenopause is your sleep suffers, and progesterone plays a huge role in helping you sleep. And when we're doing hormone replacement, helping supplementing the progesterone really improves people's sleep. It does have some effect on mood as well. There's definitely a mental aspect of that. And then the final role is in cancer prevention. Progesterone is an essential component for preventing endometrial cancer. And that'll go into one of the myths that we'll talk about in terms of hormone replacement, in terms of cancer. And that's and we'll go into my specific response to you wanting to go on hormone replacement with that. But then there's the testosterone. And testosterone, many women.
Yay, testosterone.
You're a fan.
I'm a big fan of testosterone, a huge fan, huge fan.
Yeah, testosterone, what most women don't realize is that your testosterone levels when you were in your 20s and 30s was actually quite high. Not nearly as high as men, of course, but you did have measurable levels of testosterone.
I wonder what mine was at that time frame. Like, I was like, I wonder what mine was. I'm just, who knows what my testosterone level was in my 20s, late 20s. It was a lot.
Yeah. Yeah, when I first met you, it was a lot. I was thinking you were having roid rage, but it was just no. You're just and of course there's some individual variation on that, but yeah, it plays an essential role in libido. That's one of the big things, and that's where that lawyer said it helps with divorce rates. Is when you don't have testosterone, you don't. In terms of women, then the spontaneous thoughts, erotic thoughts, just don't happen.
They're gone. There's none.
And you love your husband. You can feel that love now, but that desire, that sexual desire, certainly diminishes, if not evaporates, as your testosterone levels fall.
But why? We know this science. This is science. We know it. We know it exists. We know these are facts. It's not a question of whether or not this is reality or not. Why at this day, why in this time frame are there not more physicians that understand this? Why do people not understand this? I mean, people will go to their OBGYN or their primary and get estrogen, but not one person is offering them any other form of, there's so many other hormones that are at play in menopause. It's not just one. Our bodies have depleted of all of them. So what does it take? Where's the lack of the understanding for other? You get it, but where's the lack of understanding for a lot of other people that don't understand this?
Well, I think that there's a lot of reasons, and boy, we could spend a whole episode on that. Yeah, and I think this is a nice balance because you're coming from a woman who suffered.
Yep.
And I think that, and a lot of podcasts that I listen to, there's a lot of physician blaming going on. I went to my doctor and he didn't listen, and I'm here to defend against that. And I'm gonna push pretty strongly against that, because there's a lot of demands on physicians. Our corporate structure is now demanding that you see patients within a 15 or 20-minute time period, and these problems require, first of all, time. I need to get to know you and talk to you and figure out everything that's going on with you and what's important to you. And that the old patient-physician relationship, there was oftentimes a luxury of time to really know people, and now we're very driven to not spend a lot of time. So there's a
That's
time
part of
limitation, and your problems and not problems. I think I need to rephrase that.
You have a lot of women coming after you. Your problems.
Yeah.
What did you say? My problems. You might want to rephrase that because your wife is sitting here across from you. Rephrase that immediately. Your problems. My problem in menopause is now your problem.
Yeah, my problem with you. So I think that is one. This is a complex issue.
It really is.
And to dissect this requires some time. And so it also requires knowledge. So formal training in this is another aspect. And then we're going to get to the way to deliver this product, which the hormones.
Can I jump in really quick? I think there's one more issue. So Time. I agree with you 100%. There's physician time and seeing their patients and the structure and the way the healthcare system is now. There is there is also the knowledge. It is something that we are now women are more now vocal about, and it's becoming more people are having to learn because it was not taught in medical school. So a lot of this was not taught. So those are two factors. But I think there's also a societal factor in this that women are not listened to or their health concerns are diminished because they're women. Sorry, I'm going to put it out there. It is what it is. I think if men had a period of time in a year that they lost all of their hormones, that we as a society would just come unglued and be feeding it to them in every, health drink that there was on the shelf. That's my opinion. But I think there's a lot of reasons. I think it's the time. But I think society plays a lot of role in this too, that lack of education and how it's just figured as something that we're going to get through. But it's not something we're going to get through. It's something that we don't have to get through in the way that we are currently doing it. It does not have to be that way. There is help for it. So anyways, sorry, I just had to go for the society thing because I feel like that's a little bit part of it too.
You lost me after you said that we don't listen to you.
I bet, yes.
And I think that that we try to put men and women equal, and we're not. We're so incredibly different, and men are very, very easy. And in terms of their problems, if a man has some troubles with sexual dysfunction, the fix is usually pretty simple, straightforward. Takes 5 minutes of my time. For women, that whole thing. Being a woman is like having a browser open with 5,000 tabs active all the time, and I think the complexities of the hormones, the complexities of the because the hormone balance is very complex, the effects on you are very complex. Oprah talked about she was having heart palpitations. And so being Oprah, she went to some of the top cardiac physiologists in the world. But all of her symptoms faded away with hormone replacement. And so there's a global approach that you have to take, and because women's hormones are a little bit more complex, your responses to those are going to be harder to sort out, and I think that requires, again, time, training, and effort, and having a tool that you can use to help with that. Many physicians don't have a tool to fix the symptoms that you're having.
What do you mean they don't have a tool? I feel like there's a lot of tools. I feel like there's a ton of tools that as women we could have that are not even offered to us as options. There's a lot of tools we could have. I could have had a lot of different options prior to feeling like I was just going insane in menopause. I feel like there's a lot of tools, and I just don't understand why they aren't offered to us.
So the main tool is hormone replacement. So let's talk about that. This is you threw me a softball here so that we can take a swing at it. So when you talk about the symptoms of menopause, well, first let's just talk about how do you know that you may be needing hormone replacement? And I think that let's start with that. When you're out there and you're thinking, would I benefit? What kind of symptoms do you have? There's lots of little quizzes that you can do, but kind of tell me what your symptoms were, and that may trigger some women to seek whether or not they're to ask the question, do I even need any hormone replacement?
I think, well, I want to stop for 1 second. There's a lot of symptoms that I had, and that may be maybe this is a whole episode, a whole show of its own, a whole podcast of its own, going into all of those symptoms. So maybe we just lead into that
All
next
right.
week. We can just kind of take off from there, and there's a lot that I have to say about that. So I think maybe we lead off from we end here with the fact that it is something that we need to educate others on. It is something that there are options out there for women. We have a great educational documentary coming up on November 13th at the Zinema that is going to go through all things menopause, the whys, the stories, the specialists that will be speaking. We have a Q&A with you at the end of our filming. We'll have a Q&A with you for the attendees, and I think there's so much to be said. The rest of this, my personal symptoms, I think we delve on next week.
And do you want me to answer that question on why we don't have tools, or what tools that we have? Or
And can you say that in a really sexy, why do we not have the tools?
Why do we not have the tools at our disposal to help these women? I can say that in Spanish if you'd like.
Yes, go ahead.
No. So I think that's the question that you asked. Why are we not doing things about it? Why can't you go to your family practice, primary care, OB/GYN, and get the treatment that you need? Oftentimes you can, many times you cannot. Why is that? And we're going to delve into that in our next episode.
Thanks for joining us on a cheeky adventure through the world of wellness. Follow our spicy tips, laugh out loud stories, and expert advice designed to keep you feeling youthful, vibrant, and always in the loop.
Follow the show so you don't miss a beat. Stay connected, and let's keep the fun going.
And if there's a subject that you'd like to hear more about, please let us know. You can connect with us by clicking the contact link below or send us a message on social media.
Make sure to send this episode to a friend who could benefit from today's topics. And don't forget to leave the show a 5-star review.
Thanks for listening to The Cheeky Clinic. We'll see you in the next one.